Assalamualaikum. I am here with the new video of the cell wall inhibitors part 3, that is Carbapenem. Carbapenem are the class of the beta-lactam antibiotic with a broad spectrum of bactericidal activity. Their structure renders them highly resistant to the beta-lactamase. That means it is resistant from the beta-lactamase and it having the bactericidal activity. Imipenem can be hydrolyzed in the kidney by the enzyme dehydropeptidase, hence why it is given with the inhibitor of the dehydropeptidase cilastatin. Cilastatin is the dehydropeptidase inhibitor and it inhibits the enzyme dehydropeptidase, which ultimately decreases its nephrotoxic effect in the kidney. The clinically approved carbapenems are imipenem, meropenem, itrapenem, and doripenem. Journal points all the given by IV and IM route except meropenem, which is given IV. At the high doses, imipenem is seizurogenic. That means it precipitates out the seizures. Doripenem is particularly active against the Pseudomonas aeruginosa compared to the itrapenem, which is not. Itrapenem has the less antibacterial activity. Meropenem is bactericidal, that means it kills the bacteria, it is not the bacteriostatic, except against Listeria monocytogenes where it is bacteriostatic. As many of the drugs are bactericidal and also the bacteriostatic, so meropenem is the one of the drug from them, because it having the bactericidal and bacteriostatic activity both. Marketing slogan of the itrapenem is the power of the one, as the dose is 1 gram once daily. The power of the ones means 1 gram once daily. Pharmacokinetics. Carbapenem have the shortened half-life between 1 to 5 hours and it undergo the renal metabolism. Other beta-lactam antibiotic in the topic of this carbapenem is sulfur atom of the thiazolidine ring. It means carbapenem. In carbapenem, sulfur is replaced by the carbon atom. So you should remember from the word carbapenem, carbon atom is used or substituted in the place of the sulfur atom. Compounded with cilastatin. As described previously, cilastatin is the dehydropeptidase inhibitor and it decreases the chances of the nephrotoxicity and it displays the important role in the empiric therapy. Why? Because it having the great coverage with the microbes. That must be the targeted option in the empiric therapy. Metabolism. It resists the hydrolysis by the beta-lactamase, but it is hydrolyzed by the metallo-beta-lactamase. Meropenem pharmacokinetics. It is administered IV, penetrate into the body fluid and CSF when meninges are inflamed, but it also reaches the meninges without inflammation. Why imipenem is compounded with the cilastatin? The reason is described previously. EDR of the carbapenem, it produces nausea, vomiting, diarrhea, eosinophilia and neutropenia, less common, and it is seizurogenic. So with the high level of the carbapenem, it produces or precipitate out seizures. Monobactam having the unique structure. Only available commercial drug is azithromycin. Spectrum of activity against gram-negative pathogen like Enterobacteriaceae and P. aeruginosa. Resistant with beta-lactamase with the exception of the ESBL, that is extended spectrum beta-lactamase. Safe alternate to patients. Which type of the patient? It is the safe alternative to the patient who are allergic to penicillin, cephalosporin and the carbapenem. It have the unique structure because it doesn't have any fused ring with the beta lactam. Thank you so much.